August is National Breastfeeding Month, and we're now joined by Dr. Sobik. Thank you so much for being here.
Thank you for having me.
And so tell us a little bit about what are some of the benefits of parents breastfeeding?
Yes, so there are a lot of benefits to both mom and baby for breastfeeding. Breastfeeding provides the ideal nutrition and vitamins for a baby. It can protect babies from getting sick in the early months, such as protecting them against respiratory infections, ear infections. It's easier to digest. It can protect them from getting asthma or developing obesity later on. And a lot of people don't know how many benefits there are for moms as well. It protects them against cardiovascular disease, strokes, and heart attacks. It also is protective against breast and ovarian cancer. And moms who breastfeed tend to have an easier recovery after they deliver their baby.
Really? And how do I know if my baby's getting enough milk? That's a question that we've seen a lot.
I get that question all the time. The best way to know when your baby is hungry or if they're getting enough milk is to pay attention to their hunger cues. So early hunger cues are when they start to wake up from a nap, fluttering their eyes, kind of smacking their lips. And then a late hunger cue would be when they're crying and they're really hungry. You can also watch and count how many wet and dirty diapers they have within 24 hours. If they have a lot of them, then you know they're getting plenty to eat.
Do you know what age people should maybe start easing them away from breast milk?
That's a great question. I get that question all the time too. So the American Academy of Pediatrics and the World Health Organization recommend exclusive breastfeeding until 6 months and then starting complementary foods with solid baby foods, and then continuing breastfeeding up to 24 months. But our goal in the breastfeeding clinic is to help moms meet their goals. So as long as the mom and the baby mutually desire to breastfeed, we continue to support them.
And I know you're with the Arkansas Children's Nutrition Center. How can people find out more information about the different studies that you all do?
Yes, they can. We do a lot of studies on maternal and infant health, and we have a lot of upcoming studies on moms that are breastfeeding and babies who are breastfed, and they can call and see if there's a study that fits for them.
Are you seeing more parents opting into breastfeeding versus formula these days?
I think we are. I feel like we see a lot of moms who have had some struggles with breastfeeding, and we try to help them meet their goals. And I think that especially since the pandemic, we've seen a lot more people interested in breastfeeding.
Any words of advice you want to leave us with?
Yes, so the best advice that I can give a new mom who wants to breastfeed is to get help early on. If you're struggling, if you have pain, if you're concerned at all about breastfeeding, there are lots of resources, but they can call us today and ask for an appointment in the Arkansas Children's Breastfeeding Clinic, and we can help them meet their goals.
When they're in that postpartum stage, as they just gave birth, is there, a way that maybe I could help my neighbor or a family member that's going through that?
Yes. The best way to support a new mom is to ask what she needs and make sure that she is eating and drinking enough, help with diaper changes, and help with letting the mom get the rest that she needs as well.
You mentioned eating. Are there certain foods that may help with breastfeeding?
That's a great question. So nutrition for a breastfeeding mom is really important. It's really important that a mom eats at least 3 meals a day, gets in proteins, fruits and vegetables, healthy carbs such as oats and whole grains, and then drinks lots of water. So we recommend drinking at least 3 to 4 liters of water a day.
If they want more information about maybe coming to the Nutrition Center, where should they head?
They can head to our website, and they can call anytime to talk to one of our members of recruitment and find out more about our studies.
Thank you for coming in today.
Thank you so much for having me.
Coming up, we have more of Guess the Price.